Hello, my name is Tom, and I will be going through the skills training today. I will have with me my lovely assistant, Christian. So just by way of intro, I am the owner here of the Littleton location. Christian is our HR coordinator, and we will be going through all the skills probably for the next 2 hours. So this is an unusual, typically would use this lab space to do interactive, but with the COVID and stay at home, we are creating this video, and hopefully this will be valuable for you to prepare you for the work that you do. First thing and most important thing is hand washing. And we do hand washing first thing when we arrive in the client's home. So typically you'll go into the home, you'll say hello, greet them, and move right into hand washing. Hand washing is important throughout your shift, especially with COVID, but this is our practice and always has been our practice. If you are doing any work that would require gloves and work with bodily fluids, you would follow with hand washing. Currently, we recommend that you are routinely washing throughout your shift, that you are not touching your face, and that we're taking care and also with our clients to encourage them to wash as well. So in terms of hand washing, I think the best approach from a remote simulation is to just put your hands together with me, and I'll just go through the motion. As you are washing your hands in the sink, you would be moving them in this motion between fingers. You would be doing the nails. Hopefully you are doing this at home, doing the nails, go to the back, and you repeat this motion for about 30 seconds. Some people use the ABC song. Some people do 2 versions of Happy Birthday. Whatever you want to do, the point being, to be effective, you want to spend a reasonable amount of time washing. Christian's going to come over here. He has already laid out his towel. He's at the sink. The sink is on, I believe. I don't hear it. And he's a little shy of water. So we are going to, for simulation, assume he has been washing for 30 seconds. He has done the motions. He has just finished. He is rinsing. One thing that is important is we do not shake our hands after we are done rinsing, and Christian will demonstrate. There's no shaking your hands into the sink. That is best practice. He will grab a towel and wipe his hands, and then you will see him turn off the faucet with the towel. And we are done, and he will throw that paper towel away, and we're all set. So that is number 1, hand washing. First thing we do when we arrive. Next thing I do want to show is going to be putting on gloves. I will have Christian demonstrate. Again, we are using gloves if we're assisting with bathing, if we're assisting with any bodily fluids, if we're doing any incontinence care, we will be wearing gloves. The gloves are provided by our clients. If for some reason there is no gloves there, please call the office. We will be contacting the family to let them know. If for some reason we cannot get gloves, which are a premium in today's environment, we will get you gloves. Call the office. I would also recommend a very small investment into your career would be to buy your own box. So in a situation where there are not gloves on site, you could quickly go into action with your own spare gloves. A very small investment for $5, you can have a whole box of these things. So putting on the gloves, there is no trick. You just put them on, get them on however you can. There's nothing I can recommend to you in terms of getting them on. What I do want to show you though is how to get them off, which is very important. You're going to pinch one glove, which you'll watch Christian do. Go ahead. He is pinching the palm. Yep. Pinch the palm and pull the glove off. and then crunch that into your left hand. And then he's going to go underneath the glove. It's a little bit difficult with his heavy Rolex. and take off the glove. So hopefully you saw those motions. He is now done, and we will throw away the gloves. So very important on putting them on again is very straightforward. Taking them off, we do want to be careful. You want to pinch the palm, scrunch it into one hand, go underneath the glove. So next we're going to move and navigate around the bathroom here. One thing I want to speak to is shaving. With our clients, we only use an electric razor. We do not ever use a blade. That is very important. With our license, we cannot use a blade. So typically with shaving, what I have found, a lot of our clients shave themselves. As a caregiver, you might either help them with a spot they missed, or maybe cue them on an area that they missed. In some cases, you might be doing the shaving. That's not as common. In all cases, though, you'll be observing and might have some suggestions for them. The other thing is in terms of brushing teeth, that is something that we can assist with. It is not that common that our clients cannot brush their own teeth. The more common for our clients that have lost some of that dexterity in their hands, we have seen that we do need to assist them to put the toothpaste on a toothbrush. But in terms of actual assistance, it's pretty rare. If we are actually assisting and brushing their teeth for them, the one thing that's very important is that they are not choking or a choking hazard. If you are brushing somebody's teeth and you're seeing them choking, we need to know immediately. It might not be appropriate for us to be brushing their teeth. That's very important. The other thing, for some of our clients, we do denture care. That's common. And depending on the client, we typically would clean them for them. I don't have a pair with me, but the first thing you would do with any denture care would be to line a sink with a towel. That is very, very important. Without lining, as you are cleaning the dentures, if you were to drop them on a porcelain sink, you could damage them. So we want to be careful. These are very, very expensive, take a long time to replace. So take precaution, line it with a towel. When you clean them, I don't have a pair here, but it would be using a brush and cleaning them as you could imagine. And then you would be storing them in a solution for the night. Very straightforward. The instructions are very simple. It's usually a cup next to the sink where they're stored through the night. And I don't think that you'll struggle in terms of care for the dentures. Key thing is to protect those dentures as you're cleaning them. That's all I have here. Now I want to get into transfers. And what I'll say about transfers is, in my view, another term used is ambulation. In my view, it is the most important thing we do. I cannot emphasize it enough. The work that we do with many of our clients is to keep them safe, and they need assistance and transfer assistance. I will tell you from my perspective, my view is clients do not fall on our watch. I will tell you from experience, the most difficult calls I've ever had to make in this business over a course of 8 years is to call a family member to let them know that during our shift, their loved one has fallen and is hurt. I will tell you, with the investment these families are making and our role being there to keep them safe, they are not happy. It is not an easy call. They do not fall on our shift. And I will tell you, in both instances, it was not during the transfer that the fall happened. In both instances, we turned our attention away. And they decided to get up on their own, and they fell. I will tell you, if somebody is a fall risk, we have got to keep our eyes on them. So with that said, I want to introduce some common devices that we use to help us. This is a walker, and very common that somebody would use a walker. two things I want to show you with the walker. One is to engage the brakes. You just push these brakes down and the walker is locked in place. The other thing is to release the brakes, you just pop it up. It's ready to go. The other thing with these walkers is to collapse them. You just lift the seat. And by the way, this is a seat. If you've ever seen it in practice, if they get tired, they can sit down, which is awesome. Some of them have baskets for them to carry items. In this case, though, for me to collapse this walker, maybe to put it into the car, I would lift up the seat and I would grab, there is a handle here, and it easily collapses. And I can put it into the car. This is a wheelchair. Many of them have similar characteristics. And the one thing I want to do to introduce to you with the wheelchair is the brake mechanism is here. To engage the brake on all of them, you just move this handle forward. That'll put it in a lock position. My perspective with using a wheelchair, if we are not moving, we are locked. Even if we're on carpet and in the TV room, we lock the wheelchair. Reason being, if they try to get up and it's not locked, it could push away from them. Best practice is to keep these locked unless they're moving. The other thing, by way of intro, is as we are transferring, we would be taking off these pedals. And you can see here, a pedal is pretty straightforward. There is on every pedal these, not sure the term, but we'll call them pegs. And as we are, after transferring, if we are going to put the pedal back on the chair, we would line up the top of these, and we would practice in a simulation, but we would line up the top of these with the pegs on the chair. When we do that, they easily go into place, and I can slide it over and it's now in a lock position. I can then unlock it easily and take them off. Pretty straightforward. If you've never put them on, it can be awkward the first time. The idea of lining these up on the top of the pegs, go ahead and practice it. But after you do it once, it's pretty straightforward. The other thing with a wheelchair that is important is collapsing. And to collapse a wheelchair, it is very straightforward. You just lift up the seat and it collapses. And you can put it in your car or the client's car for easy transport. The other device from a transfer, I'll get into it, I'll actually show it, but there is a device called a slide board, and I'm gonna actually show a transfer with a slide board later, but just by way of intro, we do not use these a lot in our entire client base today. Nobody is using it, but over the history of 8 years, there has been applications where this has been used in a situation where somebody cannot stand and pivot. We have modified their transfer using this board, which I will demonstrate. The other thing, Christian, if you could grab me the Hoyer lift and roll that in here. The last device I want to introduce you into is a Hoyer lift. This is the lift that we use in our lab. We are not going to great depth at this point. I just want to introduce it to you. The Hoyer is a valuable device for us, for our clients that cannot transfer. They cannot assist us with a transfer. They cannot stand or pivot. In this case, we would do an adaptive device. It would either be a Hoyer device or another device called a sit to stand, which has actually become more the standard for us. I don't have one here in the lab. If we have a client that uses a device, you will be trained on that device on site with the client. Very important. So if you see, depending on your level of experience, I will tell you Hoyers and sit to stands are very rare. Similar to the slide board, we have no clients that use them today, but we have used them. And when we do, if you do not have experience or comfort level and you see that on the care plan, certainly let us know. Typically, we would send a training video, gauge your comfort, maybe go on to training. Depends on the individual. Just know we are happy to help you. Just let us know. So we're done with that. If you want to push that back, and we are then going to do some transferring. What I want to speak to before we get into it, which is very important. It is our expectation that every one of our clients can assist us with a transfer. So if they're in a sitting position, assist us to get them to their feet, and they can stand and pivot. If you are working with somebody that cannot assist us to their feet and stand and pivot, that is a call to the office immediately. We never do what I would consider a dead lift transfer. We do not use strength. I always say we use technique. That is very important. Please call us if they cannot assist. So this is an important tool. It is called a gait belt for clients that are a high fall risk. And I'm just going to take just a drink of water real quick. Sorry. And I just, all right. Gait belt, one size fits all. It is a lovely tool, and it gives us something to hold to. It has a buckle, and you would put the belt between the buckle and the teeth. With a couple cameras here. And I will be demonstrating that on Christian. And the location of the belt is going to be right at the rib height, which can be a little bit interesting on our female clients. In other words, essentially just underneath their chest. But it is important to have it located at the ribs. It is important that it is snug. What I mean by snug is I want to be able to get my hand or hands underneath, but beyond that, I want it snug. If we do not have these on snug, they could be a bigger danger than the gait belt. So I am going to ask Mr. Christian to lift his hands, and I'm going to put this belt on him. Try to. So I dropped it. All right. And what you're going to see here, oh, there you go. I had it. What you're going to see here is I put this on him, that I'm going to be cinching it pretty good. See, I kind of pulled it pretty tight. And I'm going to ask him, does that feel comfortable?
It feels okay.
So it's snug. You'll have to trust me. I'm going to have a little bit of extra, and I'll just put that to the side. And at this point, he has a belt on him. It's pretty snug. And the one thing that is important, if I can have you turn, is my hand position is always underneath this belt. We never want to hold the belt like this. The reason being, it could easily slip out of our hands. So our hand position is underneath. The belt is actually in the palm where our strength is. And the other thing that is very important with a belt is the distance of the client to you. Very, very important. It does me no good to be arm's length away. I have no strength. I will tell you by way of demonstration, if you were to extend your arm and I put a book on your arm, you would not be able to hold it after 30 seconds. It'd be difficult. Vice versa, if you have that arm into your body and I put that same book on your arm, you would be able to hold it. It's not that you gain more strength. It is that you have better strength because of better position. So as I am, in this case, walking with him, I'm going to have him turn. And my arm is underneath. I am very close to him. And as he walks, I'll be walking with him. Before we walk, I want to talk about body position. There's two positions. I can have my leg between his leg. That'd be my position. And my my arm is into my body. We are close. That is one position. Another one that is okay is side by side. That is okay. Some people prefer that. If you choose that, you have to know if they do fall, your first step is to come back. Okay. I'll be demonstrating from behind, and we'll just take a couple steps. You'll see that I'm very close, and I stay right with them. So I think we just left the camera. We'll come back. Point being, my arm is underneath, and I'm very close. So that is using the gait belt while they're while they're mobile. So yes. So the other purpose of the gait belt will be a transfer. And to demonstrate a transfer, we are going to have Christian sit on this bed. I am going to use this wheelchair. I'm going to make sure it's locked. And we're going to talk through a few things about a transfer. Let me just come over here. When we are, what I will say, the one thing about a transfer that is awesome is that they're all the same. So the steps that I'm going to teach you are the same steps if you are transferring from a bed to a chair to a bench, bench to a chair to a toilet, toilet to a chair to a bed. Does not matter. You do the same set of skills, which is awesome. The other thing I will say, which I've already mentioned, they must be able to assist. And at this point, we'll go into some of the steps. Let me take a step back. When you are giving instructions to our elderly, because a transfer has multiple steps, you will give them very simple instructions. What I mean by that is your instructions, my instructions to Christian would not be, I am going to have you stand up, then I'm going to have you rotate to your left, take 3 steps back till you feel the chair in your leg, and then sit down. He would look at me like, what the hell did you just say? Understanding that when we're working with elderly, our instructions are always very simple and in steps. So I'm going to give him one instruction when we start. I am going to say on 3, we're going to stand up. The other thing I want to encourage as you're building a relationship with our clients is to just ask them how they like to be transferred. Start a dialogue. Say, well, you know, where do you like me to stand? What role you like me to play? Knowing what is best practice, start a dialogue. That is important. They need to be a part of all steps. And I want to encourage that. So we are going to do a transfer. I'm going to step over here. I am going to show 2 transfers. In the first transfer, he does not need assistance. In the first transfer, he is somebody that is a fall risk, but he is fairly independent. So in that case, I'm going to reach back behind him to secure the belt. And the instructions I'm going to give him are to stand up. One of the things you're going to see is after I get him to stand up, I am going to pause. That is very important. As our elderly stand to their feet, they lose blood pressure. And a lot of times they might feel faint. So before we take any more steps in the transfer, we stop. If you are sensing that they are possibly in faint, you would sit them back down. So you'll see me pause once, and I'll also confirm that he's okay. Once he is okay, I'm going to have him rotate or pivot, and then I'm going to have him take some steps back. The most important thing when he takes some steps back is that he continues to step back until he feels, in this case, the chair on his leg. That is hugely important. You do not want to have them sit without them feeling whatever they're going to on the back of their leg, because if they come up short, you've got a problem. So let me just demonstrate these steps. Kristen, how are you today?
I'm doing good.
I'm going to transfer you to this chair.
Okay.
And on 3, we're just gonna have you stand up.
Okay.
Ready? 1, 2, 3.
Oh,
There. How you feeling?
feeling good.
Awesome. Let me just stand over here. If you'll turn, I'm gonna have you take a few steps back until you feel the chair in your leg, then reach back with your left arm and sit down. So we have completed a transfer. In this case, he's pretty independent. I was there with the belt in case he were to fall. In this case, he didn't, which I'm pleased, and we are safely in the chair. This next transfer, if I could have you go back, and I was a little remiss, sit back down. This next transfer is going to be a situation where I need to assist him to his feet. And I didn't mention the last time, but I do want to mention, as he is in a sitting position, his feet are flat on the ground and legs about shoulder width apart. This next step, I am going to assist him to his feet, as I mentioned. And for you at home, you can position yourself one of two places. You can have a position where your leg is between his leg. That is pretty common for caregivers that are shorter for comfort. In my case, I like to straddle a leg on each side. It's just a comfortable position for me. And the one thing, and I'm going to actually put my arms underneath on each side of him, if you can see. And I always, and I'll ask him to put his arms on my shoulder. And I will tell you, in my view, to get a comfort depending on relationship, I tell the clients we're going to go dancing. And in many ways, Christian and I right now are dancing. So it's a little bit awkward, but what you'll notice as part of body position, my back is straight, my knees are bent. Same instructions to Christian. I'm going to say on 3, I want you to stand up, and I'm going to assist him up. On 3, please stand up. Ready? 1, 2, 3. So he is up on his feet. Again, I'm going to confirm. Are you okay?
I am okay.
I'm going to have him turn. Notice in this case, I'm choosing to have a position in front of him. I'm going to ask him to take a step back until you feel the chair in your legs, and then reach back with your hands and sit down. I've always kept my back straight. I bent my knees. He is now safely transferred. That is the skills. So I've got a few, back to the bed. I did mention the slide board, and I just want to demonstrate how we would use it in practice. So in this case, I'm going to ask him to slide over. Nope. I'm just going to have him lean over. I'm going to put the slide board underneath. I'm positioning the chair here on the other side of the slide board. And I'm going to position here. I'm going to ask him to use his strength and work with me on 3. 1, 2, 3. We're going to go down the board. 1, 2, 3. And we've used the board to safely slide him. In this case, we would use the board if he cannot safely stand and pivot. So, and then we just pull the board out. All done. Okay. So we're done with transfers. The only other thing I want to talk about, and I'll have you stand up, and I'll put this back here, is a situation where he falls. The most important thing of this gait belt is this gait belt is not intended to stop a fall. We do not put a gait belt on to stop a fall. The purpose of the gait belt is to keep them from injuring themselves if they do fall. It's very important. I do not want you to use strength if they're going to fall. If Christian were to fall, and if I'm properly positioned, if I were to bend my knee, I'd be able to get him on my lap and lower him to the ground. In this case, I'm going to assume he is on the ground, actually. So you're going on the ground, down, down, down. And he has fallen. He is on the ground. Depending on the circumstances, I might know with certainty he's not injured. You know, if I lowered him there, I could guess. But I would still ask, is there anything hurting? Are you okay?
I am okay. A little hungry.
So in this case, I've just confirmed that he is okay. And I want to get him back on to his feet. Let me just speak to that. If for some reason there is an injury or you are concerned that he is hurt, he stays on the ground. Our next step is 911 and then the office. And we keep him on the ground. He's safe there. If we have decided that he is not injured and he's okay to get back, one of the things we can do, and I'm going to move this in position, you can use any household chair, doesn't have to be a wheelchair, but I'm going to position the wheelchair so that it can help me. I am going to ask him to move to all fours, get to all fours. I am going to position the chair in front of him. Go ahead, Christian, put your hands on that chair. And then on 3, we're gonna stand back up. Ready? 1, 2, 3, and we're back up. How do you feel? I would probably rotate him and have him sit down. So that is a method to get them back on their feet. If you cannot get them on their feet, leave them on the ground, call the office. We might come out to assist. We might call for first responders to assist. So, and that's it for ambulation. Thank you. Now we are back. And so we're gonna talk about a few skills with the client in the bed. And we're gonna do a lot of different things in the bed here. The first thing, Christian, I've arrived, and I just want, by way of intro, I have what I call a chuck pad. Christian is sitting on top of a chuck pad now, but they are a pad. We would lay them onto the bed, and they're very valuable for us in situations where maybe a client is wearing a pull-up, but maybe has situations where they bleed through it, or not bleed, I said bleed, but soil through it. And so this is just used for easy cleanup and to protect the bed. So very common. And if it's a situation where you think a client could benefit from chuck pads and they don't have them, that would be a call to the office. So in this case, I've arrived, I put on my gloves. I am going to change Christian while he's in the bed. I have a couple of things that I know I'm going to need that I have ready for me. I have a new pull-up that's clean, and I have a new chuck pad that's clean. So, and in this case, I would probably have a trash, which I don't have here. So I'm going to just introduce myself, and we're gonna go to work. So hello, Christian, good morning. My name is Tom, and how are you? I'm just gonna help you change today. Okay. Is that okay?
That seems okay to me.
All right. So I'm just going to detach your pull up, and I'm going to ask you to lift this leg, and I'm going to have you rotate away. So he is now safely rotated. I have grabbed his dirty pull up. I would put it, probably dispose it in a trash. And at this point, I would also use a wipe and clean him up in this area before I would roll him up. And I am going to also change this chuck pad. I'm rolling up this chuck pad. So I've wiped him. I'm gonna have him roll back. I'm gonna have you lift this leg. I'm gonna have you roll this way. And I'm taking the chuck pad. I'm also trashing that. I'm going to replace it. I'm going to tuck it underneath him like this. I'm going to have him roll that way. I'm going to lift this opposite leg, roll this way. So I have the chuck pad in place at this point. I'm going to do a little bit of pericare. I would use a wash, typically a disposable damp cloth, but I would wipe from front to back these areas with a washcloth and dispose it. So he has now been cleaned. He's on a chuck pad. The last step is I am going to replace his pull-up, and It's a fairly easy process. In this case, I'm going to have him rotate away from me, and I am going to place this underneath him like that. And then I'm going to have him roll towards me. At this point, I have it in place, and I'm going to complete attaching. Bringing it forward, and these are Velcro. Let me just, at this point, we got this one on this side, and I'm going to attach that here. So now he has been changed, he is safe, we are done. For his comfort, I'm going to remove this just for now, and we're going to talk about a few other skills while he's in bed. Okay, you want to just lift your body and I'll pull that out. All right, so we've changed him in the bed. A couple of the other skills that I would like to review while he's in bed, and let me just speak to this. We are simulating someone that is bedridden. I will tell you in practice, changing someone in bed, changing sheets while they're in bed, and the last thing I'm going to talk about is a bed bath, are not skills that we do commonly. So if you've not been introduced to those skills and you're maybe concerned, I will tell you again that this would be skills that are rare. And if you do get an assignment with somebody that requires that level of care and you're not comfortable, call the office. And the other thing I'll speak to with all of these skills that we do, I will endorse YouTube. It is awesome. For everything that we do, there is a very, very good YouTube. In fact, we thought about maybe using YouTube for this purpose, but we decided it would be better for us maybe to create our own video. But I will encourage you, whatever you are doing, a bed bath, a transfer, anything, there is a YouTube video. It is easy to access, very good. Please leverage that resource. So we are back with Christian. And next, I want to talk about a bedpan. And he is bedridden. This is a typical bedpan. There's a little bit of an indent here. That tells you that is the bottom of the bedpan. And I am going to be assisting him. Best practice, if you are using a bedpan, is to grab a chuck pad, put the chuck pad into the bedpan, and that just makes it a lot easier to clean. When we're done, you just roll it up, put it in the trash. You might need to sanitize the bedpan, but it's very easy to clean. If you do not have chuck pads and you're using a bedpan, you would take the bedpan with whatever waste is in it. You would take it to a toilet, dump it into the toilet, go to a sink or a shower, add water, always dump the waste into a toilet and clean it. Last step would be sanitizing it. In this case, we are going to show you 2 steps to position the bedpan. The first step is if they have strength, I'm going to have them lift their hips themselves. To do that, I'm going to tell him to bend his knees. And if he would, go ahead and lift. And I have placed the bedpan. At this point, I would give him some privacy and let him take care of matters and let him tell me when he's finished. When he's finished, I just ask him to lift his hips and I take the bedpan. Very simple, and I would start to wash. In a situation where maybe he cannot lift his hips, I can place the bedpan. Whenever we want to, if I didn't mention this, rotate somebody a certain direction, you lift the opposite leg. In this case, I want him to rotate towards me. I'm going to have him bend this knee. I am going to have him rotate towards me. I'm using my hands on his knee, hands on his shoulder. I have him in position. I'm going to put the bedpan in place and roll him on. I would do the reverse to retrieve it. Pretty simple. We'll go ahead and lift. The other thing too is that we do have situations where for a male, we might use a bottle for urine. And depending on what role we play, sometimes it's just handing them the bottle and they handle things themselves. Sometimes we have to take a larger role. That would be a discussion with the client on how you can assist them. That is bedpan. The next thing is I'm going to demonstrate changing the sheets while the client is in the bed. I will tell you, kind of mention this, you're seeing a pattern. This does not happen a lot in practice where they're bedridden and we have to change their sheets while they're in it, but it is a good skill to be introduced to. It is not common that we do this. Typically, bedding would be changed when they're not in the bed. So in this case, I am going to change this sheet while he's in it. To do that, I'm going to have him bend this knee. I'm going to have him roll to his side. And I would be grabbing the corners of the sheet and I would be tucking it underneath him like this. And eventually roll him back. I would lift this leg, roll him towards me, and I would free the sheet. The reverse would be to put a new sheet back on. I would put a new sheet back on, tuck it underneath him, I would roll him, and we would be in good shape. So again, we do not do this a lot, but by way of intro, you would have you'd have some intro on how to do it. If for some reason you had to do it and you're sitting there and saying to yourself, I remember Tom talking about this, but that was 2 years ago, go to YouTube, search a video, and in 2 minutes, you will be an expert. So, bed bath. Bed bath is, I think for a lot of our caregivers, a new skill. I will tell you, it is a very easy skill. It does not have to be a concern if you've never done it. Again, YouTube has great videos, more depth than I will go into today. But I do want to talk about a few points for bed bath. First thing for bed bath, I have 1 bucket. I would normally have 2. The other thing with a bed bath is I would have already put towels on every inch of this bed. I might be placing them by rotating him, by rolling him, but this bed would be covered in towels. I would have a soapy water, a rinse water, and I would have washcloths, which I fold and force. Here's a washcloth. I fold it once, I fold it twice, and then I would just be grabbing corners. When we are providing a bed bath, we start from the top, work our way down. Last thing we would do is rotate him to a side and finish wiping their bottom, back and bottom. We do it in sections as we move through the body. And so you would be, the only thing I guess by way of tips is we don't ever apply soap to the face. So we would get the eyes and we would get the face, but without soap. The rest of the body, we would apply soap, then rinse as we work through the body. Nothing more I want to speak to on that. The other thing, I guess one more thing is that as we are toweling off, and we'll talk about that with bathing assistants, we are careful not to rub the towel on their skin. It is always pat dry. And in this case, you'd have a lot of towels with you in certain sections. You would be pat drying them as you are working through the sections. Sections being head, arm, big leg, arm, rotate, bottom. So that is it with bed bath and bedpan, changing sheets in the bed. I think we are done here. Thank you. And we will move to toileting and move to bathing. All right.
Okay, so I had
Hi, everyone. We are now going to demonstrate toileting. And this will be, we'll do toileting and dressing. I'll have you transfer to the toilet and go ahead and sit down. So I have moved him safely to the toilet, and a couple things, so let me just speak to that. So we're on the toilet. This is a very safe spot. Pleased that we are safely transferred. If I need to assist him with wiping his bottom, what I will do is have him lean forward, and that gives me access to his bottom. Typically, we would use a form of a wet wipe that can be disposed, but that's an important skill. We wouldn't ask him to stand up for us to be able to wipe his bottom, because if he's a fall hazard, could possibly fall. The other thing is, while he's on the toilet, I might use that opportunity to change his pull-up. We had demonstrated this in the bed earlier. More common, frankly, would be to change it or help him change while he's on the toilet. So one of the things by way of introduction to a pull-up is that every pull-up has a mark on it that can be used to help the caregiver know what is the front and the back. Candidly, anybody with any experience doesn't use that. If you were to look into a pull-up, there is a pad. The high part of the pad, which I think might be difficult from a video to view, the high end of the pad is the front. So that gives you direction on the front of the pull-up. Again, difficult for you to see it in a remote environment, but trust me, where the pad is highest, that is the front. So if I were to have him on the toilet, he would be derobed at this point. And if I want to change his pull-up, which I do, I would start by running his leg and his other leg. And I am going to work this pull-up up his leg. And I am going to position this pull-up as far up as I can get it on his leg. That's very important because I have the pull-up in this position. It'll follow with pants to be pulled up as far as I can, and then his shoes. The reason we want to have all those things pulled up as high as we can get them on the leg is when I have him stand up, depending on my assistance that is needed, I would have a real quick last step to pull up the pull-up in his pants. Also, as he stands up, if I have everything pulled up as high as I can, he's going to be stable on his feet. If I had things low on his leg, I could trip him. So it's very important. In this case, I'm not going to finish. Last step was just having him stand up and pulling everything up. We are done. And I'll just take this off and put this to the side. Last thing I want to talk about, and I'm just going to take off these gloves. Actually, I'll leave them on. That's fine. Wouldn't need gloves in this step, but I'll leave them on. Go ahead and stand up, Christian, and we're just going to have a little discussion around dressing. So in this case, Christian's left side has been impacted from a stroke. It is an injured side of his body. His arm is not operable. And so if you have a situation where there's an injury or a body part does not work, an arm or leg, when we are dressing that person, we dress that side first. So you'll see me doing that in this case. I am going to grab his arm and dress him. And then I'm going to go over and on his good side, he assists and in this flattering outfit. But the point being, I have dressed him from his bad side first, then his good side. The reverse would be when I undress him, I take his good side, and then I finish with his bad side. So pretty simple. I always say in terms of assistance with dressing, that's a discussion. What do you need help with? They're going to let you know. A lot of times it's maybe just doing the buttons. They have difficulty with the dexterity of their fingers to actually finish with buttons. Again, whatever role you need to play, that's a discussion. And that's it. We're done. You're dismissed.
Thank you.
Thank you. All right, we are going to go to our last skill, which is bathing. And we do this a lot. So assistance with bathing is an important skill. We're going to go into some level of depth with this. What I will tell you is, again, as you arrive at a client, if it's new, a new client relationship, and you know there's assistance with bathing, start a discussion. How is it I can help you? They will tell you. Sometimes they're going to say, I just need you to do my hair. Sometimes they're going to say, I just need you to do my back. Whatever that role is, you understand what that role is before you start. The other thing that I want to have a little bit of discussion on is we do have situations where we have clients that are resistant to bathing. And I want you to understand, especially with dementia and Alzheimer's, that is not uncommon. For many of our clients, that feeling of having water hit their head is very scary. And so knowing that they will be resistant. A suggestion for you, if you have somebody resistant, might be to, instead of doing a shower, to maybe do a bath, which is a great option. If you think about where they might be mentally, they probably grew up as a child taking baths, and that might be more comfortable. I will tell you, if that's what you decide to do, you need to be extremely careful that you need to take care of our elderly as if it's a 2-year-old in a tub. You never turn your back. They can slip, go under, inhale the water, and drown within seconds. So be very, very careful. But it is effective, and maybe after discussion, that's what you guys decide you'll do. And you can warm a bath, transfer them in. One of the issues with the bath, though, depending on mobility, is it's very difficult to get them up. They're in a sitting position in a tub, so it might not be an option based on how much they can assist up. So keep that in mind. All right, the other thing on the topic of resistance, there are some, if you know they are resistant to bathing, one suggestion would be, as you arrive, that it does not serve you to ask them if they're ready for their shower, because they will say either, I already had it earlier today, or no, I don't need it. Knowing that, I would suggest a different approach, more of an assumptive approach, maybe turning on the water, letting them know I have the water warming up, we're ready. How can I assist you? I know that you are resistant, or maybe that would be a big word. I know that you don't like it, but let's get through this, get the bath done, and then we can go sit on the back porch and watch birds, whatever that is. There's some reward. So more of an assumptive, not asking them, assuming that it is time for the bath, and encouraging them with a reward. That is one technique. Another technique, if there is some resistance, is what is my favorite phrase. In fact, I just had this idea. Nike has the "just do it" phrase. We should fabricate hats that say "just for today." Please repeat that phrase, "just for today." That will help you in a lot of situations. If there's resistance of wearing a gait belt, we could say to them, I know you don't like this, but I want to keep you say, let me help you. If they're resistant to bathing and they don't like it, we can let them know, I know you don't like it, but let me help you just for today. The reason that phrase works is they are in the practice typically of refusing help, and we can sometimes get their cooperation if they know I'm only allowing you to do it today. So I shared that skill. It was something discovered with my own family, working with my mother. So, and it's been effective with my sisters on the topic of bathing. They get to help her every day or every other day, and the messaging is the same, just for today. So enough discussion on that. Let's get into the steps. The first thing we would do is lay down a towel. If we're in a bathroom, the floor is very dangerous for a slip hazard. So we lay down a towel. One thing as a caregiver we need to be thinking is, because we just lay down a towel to reduce the slip hazard, we just created a trip hazard. So as we are transitioning them into the bathroom, we have to do that with a lot of care. So in this case too, I just like to show our caregivers what an awesome bench looks like. If you, by demonstration, I can rotate this bench, I can transfer this client onto this bench, put this chair in place, and I can safely slide them into the tub. I will tell you, you will not ever see a chair that looks like this. What you will see in practice is a bench, either in the shower or in this case, in a tub. That is more common. But it's good for you to know that there is an adaptive piece of equipment, if we're having trouble transferring them, that we can have them purchase. So if you see that they might benefit from something like this, let us know. We'll have them purchase it. So in this case, I am assisting in transferring into the shower. I'm going to be giving cues. I might say, use your right arm on the handhold in front, step in, use your left arm on the handhold here, take a few steps back until you feel the chair on the back of your leg, if you remember from our transfers, and then reach back and sit down. I am safe. So one of the things that is important, we do a safety check in the home. In terms of grab bars, we always check. They will be there. If they are not, call the office. And the other thing is, the shower handle will be a handheld shower handle. If that is not what you observe, call the office. Those are very important. Next step is turning on the water. That is a dangerous step. And my preference is that we manage that. If the plan is, or if the client has told you they want to do that, you can allow them to. I will tell you, you watch them as if it is a 2-year-old. You are involved with that step. It is very dangerous. Preference would be that we turn on the water, we get a temperature that's comfortable to us, and we ask them to confirm it's okay. Once they confirm it's okay, we have our plan, whatever that plan is, and we put that plan into action. They might be doing most things on their own, and we're just observing. We might help remind them on some areas, some peri-care areas that maybe we're seeing they miss that they could benefit from washing. But whatever the plan is, you go into action. When we are done, we towel them off. Again, their skin is can tear very easy. We pat dry them. I would have 2 or 3 towels. They are always cold. Start throwing towels on them. When we're done running warm water, they get cold quickly. Once they are dry, we do the transition back and help them whatever role they need to bathe. To dress. So that is the key steps. Having a plan, knowing what role you play is the key thing in bathing. And nothing more I want to say on that. So hopefully this has been helpful, and look forward to working with you. And actually, one more thing before I go, catheters. Let me grab one. We do empty catheters. And so what we don't do is measure. We might have an observation on an amount, which you might say the bag was half full or 1/3 full, or we might have an observation on the color. It was red. That would be appropriate. If you're seeing those things, that would be a reason to call the office. But in emptying a catheter, this one would be a typical one that would be in the bath. Sometimes, or I'm sorry, while they're in bed. Other times they might have a catheter that is attached to their leg. It's a little bit more mobile. In either case, our role would be to empty it. We would have some kind of device. It'll be difficult to show, but I'm going to come towards the camera. I'm going to release this clip here, which is hard to do with one hand. And then you're going to see, I'm going to take my finger. If I pull this end, it's going to release that clip. And now I can, oops, there's actually water in there. I can drain it. Before I reattach, I would take a alcohol wipe on the end, and then I would reattach, and we're done. The waste would be dumped into the toilet. Whatever we used would be cleaned and sanitized, and we're done. So now I'm finished, I think. We good? Thank you.
I want you to go in a different position because you have the light behind you here. There you go.